Hi, I'm Dr. Quick, and today we're going to dive into androgenetic alopecia, or as it's more commonly known, male pattern hair loss or female pattern hair loss. Androgenetic alopecia is the most common form of hair loss, affecting both men and women, and it's primarily driven by genetics and hormonal changes, specifically the sensitivity of the hair follicles to DHT. So we have a pretty good idea of what this looks like in men: receding hairline, thinning at the crown. For women, it typically presents as diffuse or all over thinning, but it's especially noticeable at the temples here and the crown, and eventually a widening part line. And we can use those markers to rate the level of the loss. So what is happening under the surface? Hair follicles gradually shrink due to a sensitivity to DHT, which is a hormone metabolite that can be converted from either estrogen or testosterone. So this genetic predisposition to DHT sensitivity causes it to bind to the vessels that supply the hair follicle. This causes constriction, which leads to thinner, shorter, weaker strands of hair over time. So while androgenetic alopecia is a genetic condition, lifestyle factors like diet, stress, and hormonal imbalances will make it worse. That's why addressing the internal and external causes together with comprehensive naturopathic care is key to success. In office, I use a microscope to assess scalp health and look for signs of inflammation and hormonal involvement at the hair follicle itself at several problem areas on the head. So we use these photos to both diagnose and track treatment progress in a condition that is notoriously hard to overthink progress. Is my hair the same? Is it better? So we'll focus more extensively on specific treatment in upcoming videos, but one of the more promising options out there I did want to mention is the use of medical grade lasers on the scalp. So these lasers are able to penetrate deep into the dermis and actually detach DHT from the follicle. This restores proper nutrient delivery and allows for those sick hairs to start growing back stronger and healthier, eventually improving overall coverage on the scalp. So it's not just enough to lower DHT on its own, as this sensitivity to DHT occurs even with normal levels of the hormone. And for men, there's the option of finasteride, a medication that blocks the conversion from testosterone to DHT. But there are definitely real concerns with hormone balance, mood issues, and sexual health that can come with long-term use. So if you're concerned about hair thinning and looking for a comprehensive whole health approach to hair health, schedule a consult with me here at Nourish so we can look under the hood and find a treatment plan that addresses your specific contributing factors.